The bell rings for physical education class, and all students stand up from their seats, rushing to the door. They lace up their sneakers and begin stretching to prepare for the intense game of tag they're about to play. However, there is one boy who sits on a chair on the sidelines, alone. Who is he? Why is he not participating? Today, we are following the hypothetical life of Timmy, a boy living with Duchenne muscular dystrophy, also known simply as DMD. But what is DMD exactly? The Muscular Dystrophy Association describes it as a genetic disorder characterized by progressive muscle degeneration and weakness due to the alterations of a protein called dystrophin that helps keep muscle cells intact. Mutations or deletions in the dystrophin gene result in dysfunctional dystrophin. Without this protein to strengthen muscle fibers and stabilize muscle membranes, the contraction and relaxation of muscles leads to damage. These damaged muscle cells eventually stop working, which gives us characteristic phenotypes of DMD. Generally, we know that DMD is associated with learning and behavioral disabilities which gradually worsen as patients get older. In this video, we will be focusing on prevalent psychosocial or cognitive aspects that Timmy experiences at the ages of 8, 15, and 22. At the age of 8, Timmy is in the 2nd grade, or elementary school. Typically, at this age, boys are able to hold more serious conversations as their vocabularies develop at a rapid pace. Their fine motor skills are increasing, they may enjoy riding a bicycle and dancing, and their emotions become more complex as they learn more about their own feelings as well as the feelings of others. However, it is a bit different for Timmy. He struggles with keeping up with his friends in basic conversation due to his issues with comprehension and expression. While his vocabulary is not especially affected, Timmy has a hard time pronouncing words and talking about his own feelings or experiences. He attends speech therapy once a week to improve on his phonological issues. Teachers also note that Timmy seems to be a lot more frustrated than other boys. This is due to his use of steroid medications for preventative muscle failure, which takes an emotional toll on him. Oftentimes, steroid use can lead to changes in mood, like increased aggression. Along with the emotional distress he feels from having DMD in the first place, his gradual loss of ambulation prevents him from doing many things that he wants to, which leads to even more frustration. Timmy also struggles with keeping up in class at this age because he continuously misses school due to his doctor appointments. While he is able to attend, he cannot participate in vigorous activities in physical education, which isolates him from the rest of his class. Timmy struggles with making and maintaining social relationships with the rest of his peers as a result. So, how does DMD affect the brain exactly? There have been several scientific discoveries which may account for the differences in behavior in DMD children, like this study by Dornweed et al. They found that children with DMD actually have reduced gray and white brain matter, as well as reduced total brain volume in general. This finding might help to explain the difficulties in speech that Timmy faces. Smaller prefrontal cortices are often associated with stunted cognitive ability, including the memory retrieval necessary for speech. Speech problems in brain size puts DMD boys at a higher risk for developing learning disabilities like dyslexia. Oftentimes, dyslexia is evident in children at this age through their poor reading comprehension and difficulty sounding out words. At the age of 15, Timmy is now in high school, 10th grade. Expectations for teenagers typically increase during this time. Teenagers begin to think more about their goals for the future, like college or other plans after high school. The workload for students also increases drastically. For Timmy, he experiences continuous issues with short-term memory and executive functioning. This interferes with his ability to keep up with school, as he faces problems with goal-oriented behaviors like planning. Timmy also struggles with keeping up with his schoolwork, as DMD patients typically have slower informational processing speeds, causing him to work less efficiently. This age also comes with typical 15-year-old boy behavior. Usually, teenage boys long for more independence from their parents, valuing their friends over family. However, this is impossible for Timmy. Due to his need for extra care, he must spend the majority of his time with either caregivers or his parents. This causes him to become increasingly frustrated as he feels socially isolated from everyone his age. Unable to participate in many social activities, Timmy spends the majority of his time with his parents at home, socially isolated. In addition to Timmy's bad mental state, this also has an impact on his parents. A literature review of scientific discoveries provides us with a better understanding of the caregiver burden. Oftentimes, caregivers for DMD patients had poor sleep quality, reduced family function, and depression. Economic factors also cause caregivers to become extremely stressed. Therefore, Timmy's emotional state affects his parents, and the negative emotional state of his parents affects him in return. As such, depression and anxiety develops. Timmy is irritable, moody, and sometimes aggressive. A study by Payne et al. Also shows that boys with DMD are more likely to have ADHD due to the mutations affecting dystrophin isoforms, which is associated with cognitive impairment as discussed previously. While DMD causes symptoms of ADHD to be less prevalent, his impulsivity is the most noticeable. Timmy often acts or says things without thinking, he's impatient, and he interrupts other people. At inappropriate times, he sometimes acts too silly as well. As he approaches the late ambulatory phase, physical limitations and fatigue prevent him from keeping up with many social activities that his peers enjoy. While many of his classmates go to parties, play sports like basketball, and participate in other games, Timmy has to watch from the sidelines. This continues to add on to social isolation and doesn't help with his prevailing depression. At the age of 22, Timmy is an adult. He is now in the non-ambulatory phase of his life. Timmy continues to live with his parents as it's too difficult for him to live on his own. We continue to help him to keep up with his medications, physical therapy, and other regimens. His depression still affects him daily, and he's very self-depreciative, anxious, and often has hypochondriac thoughts. Learning issues are most prevalent now. As he loses finger and arm mobility, Timmy begins to lose his ability to type. While he uses speech-to-text applications, he finds that it's oftentimes time-consuming and not entirely accurate. Still, Timmy tries to take it day by day. His family and the people around him try to give him a good life, noting the little things that can make his life enjoyable. They provide him with the best possible support group that they can, and they often ask for his friends to come over to provide him with some more company. He also keeps in touch with friends through the use of the computer. Although Timmy has DMD, he maintains that he has not lived a bad life. Rather, he states that the quality of his life has been very good. He states that he does not believe that DMD is a part of his identity, and he feels loved regardless.